Welcome, everyone. Good evening to our Knowledge is Power program, presented tonight by the Leventhal Sidman JCC of Greater Boston, 1 in 40, and Sharsheret. We're excited to be with you. My name is Devorah Silverman. I'm Sharsheret's Chief Operating Officer, and I will be moderating tonight's program. As we begin, I'd like to remind you that tonight's webinar is being recorded and will be posted on Sharsheret's website, along with a transcript. All registrants will be notified when it's posted, and we encourage you to share the link. Tonight's program honors the memory and the legacy of Lauren Kordak, founder of 1 in 40. As her organization sunsets, Sharsheret is proud to take 1 in 40 under our wing. We're honored to help perpetuate Lauren's legacy as we work to educate and support even more people. You'll hear more about Lauren in a couple of moments, but first I want to share that tonight's program is part of Sharsheret's second annual summit, an array of national webinars and local programs that provide support to people who are personally affected by breast cancer and ovarian cancer, and programs that educate the Jewish community at large about BRCA and other genetic mutations and about cancer risk mitigation. The summit is generally supported by our sponsors, who are Eisai, GSK, Seagen, Daiichi Sankyo, Merck, Pfizer, Exact Sciences, and Lilly Oncology. Their generosity allows us to expand our reach, improving lives through our support services, and saving lives through our educational outreach. I hope we'll have many opportunities to gather in person at the JCC of Greater Boston in the future, but for now, we'll settle for a Zoom opportunity to officially thank the JCC and to introduce Heidi White, the Group and Fitness and Wellness Manager, to make an important announcement.
Thank you, Devorah. Good evening, everyone. My name is Heidi White, and I am the Group Fitness and Wellness Manager at JCC Greater Boston. In case you are not familiar with the JCC, we are a vibrant community located in Newton, Massachusetts, offering programs and services for people of all ages and abilities, from art classes to group fitness, culinary experiences, pickleball, swimming, inclusion groups, and so much more. JCC's programs also include 4 preschools, multiple camps, early parenting support, performances and lectures, and the list goes on, serving over 50,000 people annually. So why are we here? Melissa Rosen, who is Sharsheret's Director of Training and Education, reached out to my director, Audrey Edwards, to see if we would be interested in hosting a panelist discussion on cancer genetics and risk within the Jewish community. This topic grabbed my attention right away, as both my grandparents and aunt all passed away due to cancer, and my mother and I insisted that my aunt have genetic testing to provide additional information for our own planning. Audrey and I instantly felt a connection with Melissa. You could say love at first sight. And we were so impressed by Sharsheret's mission and role within the Jewish community, which supported JCC Greater Boston's mission to nourish minds, bodies, and spirits through a range of experiences and help ensure the continuing vitality of our community as a whole. We are so excited about our new partnership with Sharsheret and thank Sharsheret and 1 in 40 for having this important discussion with JCC Greater Boston. At this time, I would like to introduce our President and CEO, Dr. Lily Rabinoff-Goldman.
Thank you so much, Heidi, and thank you, Devora. It's wonderful to be here with all of you tonight. I'm thrilled to invest in this partnership as part of our overall wellness experience for the members of the JCC Greater Boston community, which, as Heidi mentioned, includes more than 50,000 people. And we're excited to expand that reach even further through Sharsheret and 1 in 40. Just as a means of introduction, I wanted to share that about 15 years ago, just after I was married and I was a young woman, I was at work one day and my childhood best friend, really my best friend since the week I was born, called, and in a very calm voice, she said, "Lily, I found a lump and I have breast cancer." I was like, I was 27 years old. I didn't know what that meant. And it was the kind of thing that we didn't expect would happen to us or wouldn't expect to happen to us then, or I don't know what we didn't expect, but the whole thing was such an overwhelming experience. Of course, thank God she is okay. She is healthy, she's thriving, she has wonderful children. But in retrospect, it didn't need to be such a surprise because in fact, this friend, her grandmother had had breast and ovarian cancer starting in her 30s. And we had always sort of known that that was like a thing in their family lives. And in fact, because of the miracle of modern medicine, she and her sister and her mother, and in fact, her brother, were all able to get genetic testing, and they're so much better informed to be able to make wonderful choices for them and for their beautiful children. So I actually didn't think that I would get emotional, but here I am. And even though it's so many years later, I just feel really grateful for the work that Sharsheret and 1 in 40 are doing to really help educate members of our community to be able to have the knowledge to make wonderful choices, to have the most meaningful lives that they can. And so we are so grateful to be able to partner with all of you tonight. And thank you for bringing us together. So I think I'm going to turn it back over to Devora.
Great. Thanks so much, Lily. And thank you, Heidi. We also look forward to a long and very fruitful partnership as we work together to support and to educate the greater Jewish community in Boston and its environs. It's truly a pleasure now for me to introduce Rob Korduck, Lauren's husband, a founding member of 1 in 40's board and a current member of Sharsheret's board. We've invited Rob to tell Lauren's story.
Thank you, Devora. It's really a pleasure to be here. So, I'd like to thank first just a sincere and warm thank you to JCC and to Sharsheret and to all the wonderful panelists presenting this important and life-saving information tonight. So as Devora said, my name is Rob Korduck. I'm a founding board member of 1 in 40, and I'm the widower of Lauren Korduck. Lauren was the founder and executive director of 1 in 40. Her parents, Bob and Betty, are also on the session here tonight. And Bob is the president of the board of 1 in 40. So in December of 2016, in the midst of a bout of some extraordinary back pain, Lauren and I learned that she was BRCA1 positive. Lauren had sought out genetic testing, not because a medical professional informed her of her higher risk, not because of the increased cancer on her father's side of the family, but rather because a close friend of ours, of Irish Catholic heritage actually, who had recently been diagnosed with early stage breast cancer herself, learned of these genetic mutations and informed Lauren of this and implored her to get genetic testing. And it was weeks later that we would learn that our knowledge and insight was too little too late. As Lauren received the diagnosis of stage 4 ovarian cancer in January of 2017. The back pain was actually resulting of lymph nodes that were enlarged by the cancer. And nearly 4 years later, Lauren succumbed to the cancer and died in December of 2020. But I would say that's not Lauren's story. Lauren's story is that of a loving mother to two wonderful children, and as a fun and outgoing person, quick to spark a conversation with old friends or total strangers, a lover of nature, starter of projects, Lauren had a deep and long love affair with Cape Cod. As a nonprofit executive by trade, and perhaps by calling, she founded 1 in 40 while undergoing chemotherapy in 2017. She did this to raise awareness of the BRCA1 and 2 mutation. She did this to help educate and inform others so they could be more fortunate than her. And she did this despite our disdain for the phrase to fight cancer. But in her eyes, this was a way that she could actually fight cancer. So the tragedy of Lauren's death is not just that she's no longer here. The tragedy stretches out into the future. The tragedy is not seeing our kids graduate high school or college, not being at their weddings or to hold her grandchildren. The tragedy is not being there during the tough times, not being there to hug your kids or pick them up or hold their hands when they need you. That's the real tragedy, and that's one of the things Lauren and I often spoke about, her missing in advance, if you will, all of these little moments throughout life, stolen far too soon. But if Lauren were here today, I know exactly what she would say, because we talked about this quite a bit, right? She'd tell you it's okay to be afraid and apprehensive about genetic testing. It's scary to learn if you're BRCA1 or 2 positive. It's downright terrifying. But what's more terrifying is to be on a phone call with an oncologist you just met in your bedroom with the door closed, making sure the kids are distracted so they can't hear you cry, when you're told that you've got stage 4 ovarian cancer. That'll really knock your socks off in all the wrong ways. She'd also tell you, if you're positive, you have the power and the knowledge to do what I couldn't have done, to make the decisions to radically reduce your risk through preventative procedures and enhanced screenings, where if you do discover cancer, you're almost certain to discover it at an early stage where the long-term prognosis is substantially better than catching it later, stage 3 or stage 4, which is far too common, especially with ovarian cancer. So our daughter knows about her 50-50 risk of being BRCA1 positive. She knows she'll be tested by the time she's 25. She knows that we have a plan if she's positive. And that knowledge is power. So once again, I'd like to extend a warm and deep thank you to the wonderful team at Sharsheret and JCC for inviting me to speak this evening. I speak for all of us at 1 in 40 when I say how excited we are to combine the resources of these two amazing organizations as we continue to carry out Lauren's important and life-saving mission. So thank you so much. It's a real pleasure and honor to be here tonight.
Rob, thank you so much for sharing so personally and so candidly. Before we introduce our other speakers, I want to remind everybody that Sharsheret does not provide any medical advice or perform any medical procedures. The information provided by Sharsheret and by tonight's speakers is not a substitute for medical advice or treatment. You should not use the information provided to diagnose or treat a health problem, but always seek the advice of your physician or another qualified health provider. I also want to call your attention to the Q&A feature at the bottom of your screen. If you hover your mouse over it, you'll see there's a Q&A box. If you have any questions that you would like us to pose to our speakers, please type them into that box and we'll do our best to get to all of them. Some of you have already been in touch with questions, so we're excited to dig in. We're so very fortunate to have Dr. Amy Commander with us this evening. Dr. Commander is a breast oncologist at the Massachusetts General Hospital Cancer Center. She is Director of Breast Oncology and Cancer Survivorship at the Mass General Cancer Center in Waltham and at Newton Wellesley Hospital, and is Medical Director of the Mass General Cancer Center in Waltham. She recently became the Director of Lifestyle Medicine at the Mass General Cancer Center and is also an instructor in medicine at Harvard Medical School, and she served as medical advisor to 1 in 40. Dr. Commander is board certified in hematology and medical oncology, and she is also board certified in lifestyle medicine. She's dedicated to improving the quality of life and outcome of cancer patients through lifestyle interventions, including exercise, diet, and mind-body interventions. Dr. Commander, over to you.
Thank you so much for that very kind introduction. I also just want to say that I'm truly honored to be with you all tonight. I'm certainly a fan of the JCC, and also, as you noted, I was a medical advisor on 1 in 40. I knew Lauren. I met her early on after she started this amazing organization, and she inspired me from the second I met her. So it is truly an honor to be here and think about her and the incredible legacy she has left for all of us. It's a lot for me to be here just thinking about that. So thank you so much. I'm going to share my slides, and tonight our focus is Knowledge is Power. That's a very powerful title, and I 100% agree and love that choice for tonight's session. We are going to focus on genetics and cancer risk within the Jewish community. The objectives of my discussion tonight are really what we already highlighted in the introduction: how one can know risk for cancer, develop a strategy to be proactive about one's health, and how can we detect cancer early and learn strategies for cancer risk reduction. I wanted to start off with just a basic description of what is cancer. So if you look at this figure in the top panel, this illustrates normal cell division that is happening in our bodies all the time. Cells are dividing, and when old cells die, new cells can grow, and old cells can die through something called apoptosis. And so that is normally happening in our bodies all the time. In contrast, if you look at the bottom panel, this is illustrating what can happen in the setting of a tumor, where the cells are growing, but they're not dying through natural mechanisms. And there can sometimes be mutations that occur: a first mutation, a second mutation, a third mutation, on, and cause uncontrolled growth, which leads to a tumor. So this can certainly happen in the breast, the ovary, or in other organs. And so that's a very simplistic explanation of what is cancer. Highlighting this further on this slide, again illustrating normal cells and how damage to the cell can cause these mutations over time and lead to the development of a cancer cell. So when we think about genetic mutations in cancer, I included these figures to really illustrate the difference between a sporadic cancer, something that can just happen due to environmental factors or other factors, versus a hereditary cancer. So in sporadic cancers, mutations can unfortunately build up in cells over time and lead to the development of a tumor. When we think about hereditary cancers, such as cancers related to a BRCA1 or 2 mutation or numerous other genes that we're learning about, that first mutation is inherited and present at birth, and that mutation can come from the maternal side or the paternal side. Over time, there can be additional mutations that can lead to the development of cancer. In general, hereditary cancers are rare. So if we think about all cancers, I'm a breast oncologist, so I'll focus on breast cancer, but this is pretty applicable to many different types of cancer. The majority are sporadic. We do not know exactly why they happen. Environmental factors, chemicals, etc. My next slide shows some of the potential causes for this. When we think about cancer in general, only 5 to 10% of individuals have an identifiable gene mutation. So when we think about breast and ovarian cancer, the most common genes might be BRCA1 and BRCA2. And then now we're learning more and more about other genes, which are less common. 20% may be familial. And what does that mean? That may be due to a constellation of genes that we're still learning about, which in combination with environmental factors can increase the risk of cancer. So I think it's really important to recognize that only 5 to 10% of individuals with cancer have an identifiable gene mutation. And hopefully, as research progresses, we'll have more of an understanding about what is causing the familial and sporadic cancers. This slide illustrates further what is causing these genetic changes. So certainly I just mentioned the hereditary contribution, but there are many factors in our environment, such as ultraviolet light, chemicals in our environment, smoking, of course, and viruses. And an example of that is HPV, which is a risk factor for cervical cancer, or hepatitis C, which can be a risk factor for some types of lymphoma. So when thinking about BRCA and the clinical features that come to mind, these are illustrated here on this slide. So the typical features we think about with regard to BRCA is breast cancer diagnosis at a young age. Typically, we think of under age 50. And if a woman has a type of breast cancer that we call triple negative, what does that mean? The receptors for estrogen, progesterone, and HER2 are negative. That's a particular subtype of breast cancer. And there is an increased incidence of BRCA1 mutations in individuals with that specific subtype of breast cancer. In addition, we think about BRCA potentially being present if there are multiple primary breast cancers in an individual or in the family, breast and ovarian cancer in the same woman. Ovarian cancer at any age is now an absolute indication for testing. Male breast cancer at any age is an indication for testing. Ashkenazi Jewish ancestry, which is why we're here tonight to learn more about that. And then rare cancers. There's now data suggesting that individuals with a diagnosis of pancreatic cancer or aggressive prostate cancers should also have genetic testing. I want to focus, of course, on the Ashkenazi Jewish ancestry bullet point here. So 1 in 40, the reason that organization was called 1 in 40, Lauren chose that name, is because 1 in 40 individuals of Ashkenazi Jewish ancestry may carry a BRCA1 or BRCA2 mutation. And that is illustrated on this slide, which is showing the genes. The top is BRCA1, the bottom is BRCA2. And interestingly, research has shown that regardless of an individual's family history, an Ashkenazi Jewish individual has a 1 in 40 chance of carrying one of these mutations. And I think it's also very important to note that there are 3 specific alleles, and I don't want to get too technical, but as you see, I don't know if you can see my little cursor here, but there's 3 specific areas of the genes that tend to be mutated in individuals of Ashkenazi Jewish ancestry. And this is because these are called founder mutations. And it is really interesting that the vast majority of individuals of Ashkenazi Jewish ancestry who may have a BRCA1 or 2 mutation will have a mutation in one of these specific sites. So you may have heard the term 3-site testing, which was used in the past. They could test just those 3 specific sites. Now we have so much more sophisticated genetic testing that we would test for other potential mutations as well. But I think it's really important to note that these 3 sites are the most prevalent. And again, they are present in 1 in 40 individuals of Ashkenazi Jewish ancestry, men and women, okay? In terms of non-Ashkenazi populations, the frequency is 1 in 400, so much less common. So if we think about the average woman walking down the street and what is her risk for developing breast or ovarian cancer, in the United States, that risk for breast cancer is 1 in 8. So somewhere between 12 and 13%. For ovarian cancer, that risk is lower. It's about 1 in 67 women will develop ovarian cancer. But what about if an individual carries a BRCA1 or 2 mutation? So if you look at panel A, this is illustrating the cumulative risk of first breast cancer diagnoses among BRCA1 and BRCA2 mutation carriers. And as you can see, the x-axis is showing age from 20 to age 80, and the y-axis is breast cancer risk. And as you can see, these individuals, as they get older, have a significantly heightened risk for development of breast cancer. It goes up to, potentially up to 75, 80% for these individuals. Panel B looks at the cumulative risk of ovarian cancer among BRCA1 and 2 mutation carriers. And as you can see, for BRCA1 carriers, there is a higher cumulative risk for development of ovarian cancer compared to BRCA2 carriers. But this risk is quite high, which is why it is so important to identify these mutations early on so we can think about strategies for risk reduction. In addition, research has shown that BRCA mutations can be associated with other cancers. We're learning more and more about this and how we can screen for these cancers, but I think this is very important to review. So when we think about a BRCA1 mutation, we just discussed how that can significantly increase the risk of breast and ovarian cancer, but it's also important to note that presence of this mutation can increase the risk of male breast cancer and prostate cancer, as well as pancreatic cancer. That risk is quite low, 1 to 3%, but I think it's still very important to recognize that. Similarly, when we look at BRCA2 mutation carriers, again, the risk for breast cancer is quite high. Risk for ovarian cancer is heightened, less than BRCA1, but still quite high. Male breast cancer risk is greater. Risk for prostate cancer is greater, and risk for pancreatic cancer, as well as melanoma, is increased. So when I see a patient who carries one of these mutations, I'm thinking about certainly her risk for breast and ovarian cancer, but what do we need to do in terms of screening potentially for pancreatic cancer or melanoma? And we'll talk a little bit more about that later in this presentation, since we are learning more about how we can potentially screen for something like pancreatic cancer. And certainly in a male individual, we would talk about prostate cancer screening. The panel over here illustrates the general population risk for these cancers, which, as you can see, is significantly lower. So that's why this is really important information to be aware of the other cancer risks. So how do we think about screening and risk reduction for breast cancer and BRCA carriers? So I've outlined these guidelines, which I should say do get updated. There's something called the National Comprehensive Cancer Network, or NCCN, which really provides excellent guidelines on screening, risk reduction, and actually treatment for different types of cancer. So it's a great resource for those of us in the field. So the first bullet point is breast awareness, certainly starting at age 18 for BRCA mutation carriers. Clinical breast exams, I would say every 6 months, starting at age 25. Mammography, so in the average woman walking down the street in the United States, she does not need to necessarily start mammograms till age 40 or 45, depending on which medical organization's guidelines are following. But for a BRCA carrier, we definitely would start at age 30. Breast MRI, which is another excellent screening tool, would start at age 25. And typically we alternate them. So the MRI would be done, let's say, in January, and the mammogram is done 6 months later, and you just alternate them every 6 months. Prophylactic surgery is certainly a consideration as well, and it's very much a personal choice, but some women may choose to have prophylactic mastectomies. And also some women may consider the role of a prophylactic oophorectomy after childbearing and it's important to note these ages on the slide. As I showed earlier, the risk for ovarian cancer in a woman with a BRCA1 mutation is much higher than for a woman with a BRCA2 mutation, and in terms of the ages of when these cancers may be diagnosed. So, certainly we would recommend a BRCA1 mutation carrier to consider a prophylactic oophorectomy between ages 35 to 40. And maybe a 40 to 45 for a BRCA2 carrier. Interestingly, the prophylactic oophorectomy not only can help reduce risk for ovarian cancer, which we'll talk about shortly, but also reduces risk for breast cancer, which is a very important point. Chemoprevention also may play a role. What is chemoprevention? Chemoprevention involves use of medications. Many of you have heard of tamoxifen, raloxifene, aromatase inhibitors. These drugs are actually used to treat breast cancer, but studies have also shown that these are beneficial for prevention of breast cancer as well. So that is also an option. In terms of ovarian cancer risk reduction, interestingly, screening for ovarian cancer is very limited. So in the past, we used to draw blood tests called the CA-125 and consider use of a pelvic ultrasound. This has been studied, and actually more recent studies have shown that this type of screening approach is not beneficial. We are certainly looking for better screening approaches, and I'm hopeful in the next 10 years we'll have something that's better for screening for ovarian cancer. At present, the best way to handle this, as I mentioned on the previous slide, is to consider a prophylactic bilateral oophorectomy. And again, the ages are listed here. Interestingly, there's also research recently regarding the role of a prophylactic salpingectomy. And what does that mean? That's removal of the fallopian tubes. It's really interesting that ovarian cancers tend to start in the fallopian tube. So a young woman who maybe, we're looking at the effects of early menopause, right? Which is obviously takes a major toll on the body. So there is research looking at, can we remove the fallopian tubes and then maybe remove the ovaries a few years later? And is that an effective approach? So that's something that's certainly being studied and investigated further. What about male BRCA carriers? So again, I mentioned the increased risk for prostate cancer, and prostate cancer screening is a controversial topic in the general population, but for a male BRCA carrier, that should start at age 40. Clinical breast exams are important as well. Men certainly would have a lower risk for development of breast cancer, but a male BRCA carrier, we do want to be aware of that. And obviously teach our male patients about the role of breast self-exams starting at age 35. Again, knowledge is power. I can't emphasize that enough. I wish I could prevent all breast, ovarian, and all types of cancers out there, and I will find something else to do. So it's a very important goal of mine, like Lauren, like all of the panelists here, to help educate so we can identify those individuals who are at increased risk and help implement strategies to manage that risk. In the introduction, it was mentioned that I'm also very interested in lifestyle medicine. And I just wanted to share this slide because certainly the genetic risk plays a key role. And that is something I definitely want to highlight tonight in this presentation. But I do want to highlight as well that there is increasing evidence about the important role lifestyle factors play in terms of risk for cancer development. This figure is taken from the American Institute of Cancer Research, which is a very evidence-based site, which illustrates a number of recommendations in terms of diet, exercise, and other lifestyle interventions that are important for cancer risk reduction. And earlier we learned about the health and wellness opportunities at the JCC, so I'll put in a plug for that too. It's so good for our overall health. Finally, I want to give a shout out to a colleague of mine at Mass General, Dr. April Hirschberg, who has developed this amazing program for individuals at high risk for cancer. It's called the SMART program. And really the goal is to help reduce stress, physical, emotional symptoms, and help develop coping strategies for individuals who do carry a mutation that puts them at risk for cancer. And her contact information is here if you're interested in this program, which it looks like it starts up again in January of next year. Finally, since I do work at Mass General, I thought I'd share some information about our genetic testing program. We have a wonderful array of genetic counselors. I think my colleague Jeanette Lawrence is on here, and she shared with me some slides for this presentation. They're all wonderful, so I wanted to make sure you had access to that. There's also medical grade consumer testing that can be considered, and we can probably get into this a little bit more in the discussion, but I wanted to share some resources here as well. So thank you so much for the opportunity to speak tonight. Knowledge is power. I'll turn it over to the next speaker.
Thank you so much, Dr. Commander. That was incredible. No matter how many times I hear people expert in the field speak about cancer, I learned something, and I'm sure I speak for all of the participants this evening and those who will be watching the video after. When I thank you for sharing your expertise. I want to also remind everybody that if you have questions for Dr. Commander, we'll get to those a little later. You can type them into the Q&A box that you can find at the bottom of your screen. Next, we have with us Shara Dubitsky. Shara holds a master's in education and a master's in arts and is a graduate of Columbia University and a doctoral candidate at Adelphi University Institute of Advanced Psychological Studies. As Sharshara's former Director of Navigation and Support Services, Shara serves as a special advisor to the clinical team at Sharshara and speaks nationally on issues that are unique to Jewish women facing cancer at every stage. All of us on tonight's webinar understand that being diagnosed with cancer or with a genetic mutation like BRCA includes much more than a physical and medical experience. Shara will speak about the psychosocial support services that Sharshara provides to those who are personally affected and at elevated risk for cancer. Over to you, Shara.
Thanks, Devora. I want to just take a moment to thank Rob and the whole Kordock family for sharing certainly the pictures of Lauren. It was really amazing to see that and to tell us more about Lauren and the impact that your family is having. So I wanted to thank you for that. So my mom was diagnosed with stage 4 breast cancer. She was 41 and I was 13. And though she passed away 6 years later, I believe that she fought a mighty battle and she won. She lived those 6 years on her terms, and she led the charge on how we as a family were going to do this. So we were going to face metastatic breast cancer with knowledge and with honesty, with a lot of humor, and we were glad to accept any support that was offered to us. When I became a young adult, my self-described status was patient in waiting. So every time I went to the OB/GYN and had a medical breast exam, I was thinking, oh, is this going to be the time that they're going to find something? Or whenever I undergo screening, I think, oh, is this going to be the time that they're going to find cancer? And every time that I sense something different in my body, I wonder, oh, do I have cancer? And I used to make my husband crazy because every time I was like, oh, I wonder if I have cancer. Except there was one time where I progressed and regressed within a minute, where I was having some back pains. And I said to my husband, I wonder if I have spinal meningitis. And he said, well, isn't that just something for kids and teens? And I was like, oh, you're right. Then it must be cancer. So having a high family risk certainly sets up this domino effect of decision making. So what are some of those decisions? So the first one is, do I even go for genetic testing? So obviously it would make sense to do it, but was I really ready to do it? And was I prepared to, do anything if I did test positive? So, I know for myself that I'm grateful for the many conversations that I've had with women and their families who've called into Sharsheret with these same questions, having to make these same decisions. So we had one woman who called Sharsheret, and she told me that she was diagnosed with stage 2 breast cancer. And her doctor said, listen, before we go ahead and do surgery, I want you to undergo genetic testing because of your ethnicity. So she said, well, what does my ethnicity have to do with anything? So he said, don't you know that as an Ashkenazi Jew, you're more at risk of carrying the BRCA mutation, and it could change some of your surgical decisions. So the woman paused for a moment and she said, all right, well, what if I convert? So clearly she didn't convert, but she did decide to undergo testing. So once someone decides to test and they're positive, there's a whole host of decisions similar to what Dr. Commander was talking about that people need to consider. So many women are encouraged to undergo prophylactic surgery. Some feel pressured. Other women feel pushback. I had a woman who called me and she said, so I don't have a cancer diagnosis. I do have an extensive family history of breast and ovarian cancer, and I did test positive for the BRCA mutation. So the doctors all agreed that she should consider prophylactic surgery. So she said that she decided to go ahead and have a total hysterectomy and bilateral mastectomy. Now, she said that she found it hard to come to terms with what she was going through, even though she already made the decision. So some of the questions she posed was, okay, I'm going to go undergo the surgery. Am I a survivor or not? How do I explain this to people? Would people understand why I did this? Would they wonder why I'm removing currently healthy parts of my body? And how do I come to terms with my own decision? So she said it was a meeting with her rabbi that made it clear to her. The rabbi looked at her and said, you are fighting cancer, just at its earliest stage. So she believed, kind of like, again, what Dr. Commander was saying, like, who knows what's going to be down the road. So she believed that in the future, maybe 10 years, 20 years down the road, there will be other options available for women. And she said, some may think that her decision to have surgery was radical, but then she concludes, for now, this is my only option I have to be here when those advances are made. So I'm taking it. Some women decide for increased surveillance. So for example, a woman may want to continue to grow her family or start a family, and she may put off prophylactic surgery until she finishes having children. And so therefore she's having increased surveillance, but you can imagine the stress of feeling like a patient in waiting for this woman is certainly heightened. So more decisions. Many women and family members are calling, they're asking, okay, so I did the testing. How do I go ahead and share this information with my family? Do I share the information? Are there certain members of the family I should be telling, like siblings and cousins? And, you know, there are times when we've had people calling into Sharsheret telling us that there were instances where siblings all tested at the same time. And can you imagine for that sibling group, for those who tested negative and for those who tested positive, and for that one sibling who tests negative and have a sibling who tests positive, there is a presence of guilt and feeling badly about that. You know, let's look at mom or dad who test positive, and now they have to face very difficult decisions of, when do I tell my kids? How do I tell my kids? Oh my God, my kids, how can I possibly share this with my kids? So speaking of kids, I always embarrass my kids because I love the lost and found boxes in institutions, like in the schools and the museums and in synagogues, because I'm always fascinated by things that people lose and the things that people decide to turn in when it's presumed lost. Like, really, who's retrieving a toothbrush? But thinking about the losses that women have described after testing positive and undergoing prophylactic surgery, here are some of the losses that we hear about. So one of them is the loss of the breasts, right? That's the obvious. And even with reconstruction, and there are lots of options for reconstruction, it has an impact on a woman's body image and on a woman's self-esteem. And also women worry about their partners and how this is going to impact them and their relationships sexually and in intimacy. Some women who undergo prophylactic surgeries have spoken about identity confusion. So as the woman that I mentioned earlier, she asked, so am I a cancer survivor or not? I don't have cancer, but I did the surgeries, I did the recovery, I still have the scars. And, you know, she kind of feels like doesn't know how to identify herself. So in some circles, these women don't see themselves as survivors, but rather they call themselves previvors. For the woman who chose to have her ovaries or her fallopian tubes removed, her fertility choices are now really limited. And she will have to think of other options to grow her family. So that you can imagine, for a young woman who opted for the prophylactic oophorectomy or hysterectomy, she may feel a disconnection, and in some cases, a sense of not belonging to the same age peer group anymore. So while those in her peer group are discussing menstruation and fertility, her new peer group are older women talking about hot flashes and other symptoms of menopause. There's also a pretty big loss of peace of mind worrying about the genetic risk of cancer that could be passed on to future generations of children in his or her family. So those are the losses. But now to the found. We have Sharsheret, right? And we are in good company, partnering with 1 in 40 and the JCC of Greater Boston and the Bassett Center and all those other pharmaceutical companies that Devora had mentioned in her introduction. And all of us are supporting individuals and families with an elevated hereditary risk, and also for those families living with hereditary cancer. So we believe that your emotional health is as critical as your medical health. And your support team is as important as your medical team. Anyone can call Sharsheret to discuss all these concerns that I've highlighted. Everything we offer is free and confidential. Everything we offer is virtual. So we understand that people live busy lives. And in this respect, you can call us from the comfort of your home or from your office, or if you need privacy, from your car. We have people calling us before a doctor's appointment while waiting in the waiting room and right after a doctor's appointment. Anyone can call and speak with our genetic counselor. She will discuss if you're even a candidate for genetic testing and the implications of testing positive. Family members can also get on a Zoom call with all the members on there and speak with our genetic counselor and ask questions and receive the same information that is specific to their family and hear it all at the same time. The great news today is that there is a reduced risk of cancer-related deaths for those individuals carrying the BRCA mutation. So as Dr. Commander said, know your family history. The more you know about your past, the better you can protect your future. We also encourage women and their families to empower themselves and to advocate for themselves. You know, years ago, I had a young woman tell me a story how she said to her doctor that she felt like something wasn't right. So the doctor told her what she wanted to hear. Don't worry about it. Nothing's going on, because it's very rare for women your age to have breast cancer. So this is how she describes it to me. As she was leaving the doctor's office, she remembers having her hand on the doorknob, and she took her hand off and she said, "No, I want you to investigate this." And it turns out that she did end up having breast cancer. We encourage you to stay on top of your doctor appointments and, make sure all your doctors have the family history. Also, as Dr. Commander was saying, choose to have healthy living. So you have to eat well. And everything that was on that screen is okay. It just needs to be in moderation. So, I remember being at a Weight Watcher meeting and they were talking, the leader said something about how an apple is 1 point. And somebody said, well, is that a medium-sized apple or a large apple? And the leader of the group was like, come on, we're all not sitting here because the apple was too big, right? But that we should do everything in moderation. Try to stay active, keep yourself moving. And as hard as it is important to reduce stress. So I'm so happy that Dr. Commander has a resource in Dr. April Hirschberg, right? That's a great thing. So if you want to do, if you want to focus on mindfulness and just reducing stress, to look out for those resources. I'm also sure that the JCC probably offers those kind of classes as well. We live in a time of information, and it's a double-edged sword. So having information at your fingertips is empowering, but sometimes it's frightening. You can call Sharsheret and speak to a social worker or to the genetic counselor to clarify anything you may see. Sharsheret frequently offers webinars like tonight's webinars with the latest research and findings, and all of our webinars are on Sharsheret's website. Sharsheret has a strong relationship with hospitals and doctors and pharmaceutical companies, and we've conducted many presentations sharing issues that we're hearing from women and their families about their medical concerns, as well as the specific issues to Jewish families that are facing a high genetic risk or cancer. You can call and we can connect you to another woman like you who has a strong family history, who's considering testing, who's considering surgery. And she's ahead of you on that road, and she can really share her experience. We also have a Facebook page for those women who have a genetic risk, literally giving women access to Sharsheret 24/7. And Sharsheret has spoken with men, and we do understand the stigma of risk and the nuance of being screened as a man for breast cancer. And Sharsheret can connect these men with resources that address these concerns. And probably the biggest find in the lost and found box is the inner strength that many women didn't know they had until they set foot on this genetic or cancer journey. I want to share one of my favorite stories from a caller that I spoke with at Sharsheret. Next slide. So I get a phone call from a woman, and she identifies herself as a Mennonite from the Midwest. And she's telling me that she has stage 3 breast cancer. And as she's talking to me, I'm hearing this weird noise in the background. And I said to her, listen, I know that you're telling me something very serious, but are there live farm animals from where you're calling? And she said, yes, I'm trying to chase this one chicken. I can't find it. And I was thinking, okay, that's not my typical Brooklyn phone call, right? So I said, what's the story? So she said that both her parents were deceased. So she gets diagnosed with stage 3 breast cancer. And the doctor says, listen, you're very young. I want to go ahead and do genetic testing on you. So it turns out she tests positive for the BRCA mutation. So she goes to the maternal aunt because both her parents are deceased. And she said, it's so weird that I carry this mutation, given that we don't have a family history. So the aunt said, why are you behaving like this? Why are you so surprised? How do you even know your history? Because you're adopted. So she goes, I'm adopted? So in 1 week, she has to process the fact that she has stage 3 breast cancer, that she has the BRCA mutation, and she's adopted. So she says to the aunt, what's the deal? What's the story? So the aunt said, so 40 years ago, there was this Jewish man walking through the Midwest and carrying an infant. Biological Jewish mom had passed away. And so he gets to this farm, and the farmer says, listen, Jews aren't so popular around here. Why don't you stay here? You'll work on the farm, and my wife will watch the baby during the day. So they do that. And then there's this horrific fire on the farm, and it kills biological dad. So the Mennonites do these home births. They write out these birth certificates, and they send it to the government. So that's what they did for this baby. So this is like the craziest story. So I said, listen, I can sit here and listen to this all day, but you did call Sharsheret for support. So first of all, how did you even find us? And she said, I Googled breast cancer and Jewish, and that's how she found us. So I said, so are you getting any support from your church? So she says, well, I was kicked out of the church a couple of years ago because I was considered very outspoken as a woman. And I said, aha, that's your Jewish genes. So, we offered her all the support. She had a match. She spoke to our genetic counselor. She got all of our resources. Her kids got our resources. And it was really an unbelievable story. And we hear things like that all the time from people who identify as not Jewish, who go for this testing and find out that, in fact, they have some Jewish genetic history. So I wish that Sharsheret was around when my mom was diagnosed. She would have benefited from the Embrace program for women living with advanced breast cancer or ovarian cancer. And we would have benefited from the resources for family and children. We would have been part of a community support that didn't exist back then. So to imagine that, imagine having an organization like Sharsheret or 1 in 40, and to be able to go to the Jewish Community Center, how much more enriched we would have felt. So today, my brothers, my dad, and I are part of the Sharsheret family. And like the Kordoks, we do have powerful voices, and we're keeping the legacies of our loved ones alive and strong. Devora?
Shara, thank you so much. I love how you were able to weave in stories about so many of the resources and services that Sharsheret offers. And so before we turn to the questions that we have for Dr. Commander and for you, Shara, we want to share one more story, and that comes from our Sharsheret caller, Irene Stern-Frelich. She's from the Boston area, and she's going to share her story with us this evening. It's important for us not only to hear from professionals, but to hear from the people who share their own stories and to provide the context, the important context for the information that Dr. Commander and Shara have shared with us already. So I want to turn now to you, Irene.
Thank you so much, Devorah, and everybody for such moving and fascinating stories and medical information. I learned so much tonight. So 14 and a half years ago, this month actually, I went for my annual mammogram. I didn't want to go because who wants to go for a mammogram? And, you know, I had this excuse in my mind. I was a little busy. I didn't have time. If I skip one year, it won't be such a big deal, will it? But I actually never got around to canceling it. So I went anyway. And that decision, I believe, turned out to be a lifesaver for me. They found a lump. They biopsied it right away, and they told me it was breast cancer. I met with an oncologist who told me I would need a lumpectomy, then 5 months of chemotherapy, then 6 weeks of radiation treatment, and then I'd need to continue monitoring myself even more closely than I had before. That was the plan. By the way, I just want to share with you something of particular note. That lump that the mammogram found was so hidden that none of my doctors could feel it, even though they knew exactly where it was. So when I say that getting that mammogram on that day, sticking to my routine, it really was a lifesaver, I believe. To be honest, like a lot of other speakers today, I wasn't so surprised I'd get breast cancer. I sort of expected this diagnosis at some point. I knew my chances were high, especially since my mother was diagnosed at the age of 52. I just didn't expect it so early. I was still in my 40s. And I was concerned that since my mother had breast cancer, I might be at an even higher risk for a second diagnosis. So during the time of my treatment, I decided to be tested for the BRCA gene mutation. My doctor helped me to arrange it, so it was a medical grade test, and that allowed me to act immediately on the results. And as you already heard mentioned, you can get medical grade testing through your doctor in a regular lab or through JScreen, which recently began their hereditary cancer genetic testing. It was an easy saliva test that would determine if I had a higher chance of getting ovarian or a second breast cancer. And as you've heard tonight, the BRCA mutation is significantly more common in men and women of Ashkenazi descent than in the general population. So it turns out I was positive for one of the BRCA mutations. And this knowledge helped guide me through the rest of my treatment plan. As a result, and after talking with a lot of people, including people from Sharsheret, I elected to have additional surgeries. The first one was just 3 weeks after chemo ended, I will share that I have the salpingo oophorectomy and then prophylactic mastectomies. So I went for it all. I just wanted to not have to worry about that anymore. It was tough for sure, but I'm here now and I'm able to share my story and live my life, and I'm so grateful for that. So I know that's all a bit overwhelming, and probably many of the stories have been overwhelming tonight. Hopefully you'll never need to learn all the terminology and the side effects and prognoses associated with breast or ovarian or really any cancer. But unfortunately, because of higher risk among Ashkenazi women, chances are pretty good that you will know someone who'll be diagnosed with breast or ovarian cancer. So 14 and a half years later, what sticks with me the most? Honestly, it's the gratitude that I feel about my experiences. That might sound odd, but Shira put it really well. There was the lost, but there's the found. And a lot of what I found was the gifts I got, material gifts, but also those of love and support throughout my treatment period and even after. Just a word about what Sharsheret provided for me. I actually hadn't heard of them until I was diagnosed with breast cancer. And when I connected with them, one of the things they provided for me was my peer supporter. And she had recently been treated for breast cancer, and we were paired together because our treatment plans and decision options were similar. And I just found it so helpful to talk with someone kind of in the same boat as I was, but as Shira said, a few months ahead of me, hearing how her story went and what helped her make decisions. And once I got to a place well after my surgeries that I felt I could provide support to newly diagnosed women, I volunteered to be a Sharsheret Link myself. I am also very grateful that I had the opportunity to have the medical grade genetic testing and to have my doctors help guide me through all my really tough medical decisions. And most important, I have so much gratitude that I can live my life fully. I can spend meaningful time with my friends and family, and I can continue to chip away at accomplishing my life goals. I'm so grateful and appreciative to be included here with Sharsheret, 1 in 40, and the JCC of Greater Boston. And I thank you so much for listening to my story. Thank you.
Thank you. Thank you, Irene, for sharing. We're so grateful. And we wish you continued good health. So time now for your questions. And Dr. Commander, the first are for you. First question, does it make sense for someone who's already been diagnosed with cancer to go through genetic testing? And if so, why?
That's a great question. And absolutely. I did show on the slide that for an individual, a woman, let's say of Ashkenazi Jewish ancestry, who does have a diagnosis of breast cancer, and she's gone through her treatment and hopefully doing well, and wondering tonight, should I have genetic testing? My doctor didn't mention it, or I didn't do it for whatever reason. Individuals who've had a breast cancer, you could be unfortunately at risk for a subsequent breast cancer in the future in the same breast or in the contralateral breast. So I would definitely encourage you to do that testing. And also that testing, of course, has implications for other family members. And certainly we've touched on that tonight, that may be a tough decision, adding to the decision, but again, knowledge is power. So I certainly would encourage you to think about doing the testing, certainly for yourself and for information for your family.
Mm-hmm. On a related theme, Shira, somebody sent in the question, it's hard for me to speak with my relatives about my positive BRCA result. I don't think they want to know. Am I obligated to share my results? How can I make them listen?
So we've had those calls where there are some family members who decided to test and some who didn't. And it's hard. We can't make decisions on someone else's behalf, and we have to respect the choices that they make. So I do think that, I'm not a believer in yes or no answers. I always believe that there's something in between. So I think our recommendation will be, look, I underwent genetic testing. Are you interested in knowing what the results are? Are you interested in hearing about it, in calling, Sharsheret's genetic counselor and getting on a phone call together? And this way you can ask questions. And if the person says, I'm not interested, then I think that you've done your due diligence and you left the answer, the decision making in their hands. But I do think that it is important to say, I did do it. Are you interested?
Dr. Commander, somebody shared the following. My mom died of breast cancer, never having undergone genetic testing. I tested BRCA negative. Does that mean I no longer have to worry about any elevated risk?
That's a great question. So if this individual's mother, died of breast cancer, I would want to know what age, certainly, as I mentioned, under age 50, or for perhaps was a triple negative breast cancer, that would certainly raise my concern. Could she have potentially had a mutation? Wait, this individual did have testing already, you said?
Yes, she tested negative for BRCA.
Okay. So I will say in 2022, we do have many other genes we can test for. So certainly among Jewish women, BRCA1 and BRCA2 are the ones we're focusing on tonight, but there are less common genes that may have lower penetrance, which means maybe less of a risk of cancer, but certainly are still important for testing. So I think depending on the age of the mother, there could still be an inherited mutation, PALB2, CHEK2. I could go on and on. We now have panels that test for many of these genes. So I would recommend that that individual meet with a genetic counselor to explore those options further. I would not do the testing on my own. I'd recommend meeting with a counselor to have specific advice about which testing panel to proceed with.
So you've just shared a little bit about some of the newer mutations that are being researched and that we should be concerned with. Are there any updates that you can share with us specific to the BRCA mutation?
Well, there's actually so much exciting research specifically about the BRCA mutation that, I only had 20 minutes, so I couldn't go into everything. But one very exciting area is actually the fact that we have drugs called PARP inhibitors, a new class of drugs that are extremely effective in the treatment of individuals who have a breast or ovarian cancer that may be related to a BRCA mutation. So now there's a study called the Olympia study for women with early stage higher risk breast cancer. And the breast cancer has to have certain characteristics, but we now know that taking this drug called a PARP inhibitor actually helps further prevent any future risk of recurrence. And those drugs also work on mechanisms in terms of sort of similar to, so the BRCA mutation is preventing DNA repair through a certain mechanism, and that's what PARP inhibitors do as well. So that's just one example that this class of drugs has been studied and found to be very effective in these individuals and for ovarian cancer too. That's just one of many examples I can give, but there's really lots of research in this area that's very exciting.
That's great. Shara, somebody shared that she tested positive for the BRCA mutation and chose prophylactic surgery and is now having a difficult time and feeling tremendous guilt, worried that she passed the genetic mutation on to her children. How might she alleviate some of that guilt?
So, there's something that I would say, I'm not going to get into that, but I would say that that's something that she could speak either to the social worker at Sharsheret or get a peer supporter who understands what it's like to have that guilt. But I think the positive thing, and I think Dr. Commander was referring to this, and even that caller that I was speaking about, is the landscape of genetics can look very different by the time her daughter needs to even be thinking, or her children need to even be thinking about this. So, I think that is something that we should keep in mind, that maybe their options are going to look different by then. So I think, we tend to do a lot of creative writing in our head, right? And we have all these narratives, but at the end of the day, we really don't know what's going to be 10 years from now or 20 years from now when that's going to be a concern. So I think that there are things that this mom or dad can do for their children right now, which is knowledge is power, taking care of themselves, eating in moderation, being active, doing things that are, reduce stress. So instead of feeling all that guilt, put it into a more positive action and give the message to your kid. It's really important to take care of yourselves.
That's great. Thank you. Okay, a few more questions that have come in. My results showed that I have a variant of uncertain significance. What does that mean?
Yes, we love these, but it actually means exactly what it sounds like. So as our ability to do these testing panels where we can test for a wide array of genes, including the BRCA1 and 2 genes, but many other genes, we're now finding these variants, which really are of unknown significance. We really just don't know if they potentially are related to an increased risk of cancer or not. So certainly there are databases for these variants. And, if an individual has seen a genetic counselor and, that variant is sort of in their chart, at some point, if it's determined that that variant may be pathogenic, or which means related to cancer risk, the individual would later be notified. But it really means it is of unknown significance. So we would not recommend aggressive surgeries or anything like that for that particular finding.
how would you guide someone who's concerned about being in touch with a genetic counselor or pursuing any kind of genetic screening because the process might have some type of adverse effect on their health insurance or life insurance?
That's certainly, Shara, I don't know if you want to take that one.
I'm thinking you're in the medical field.
I thought you were about to speak, but certainly, well, that's why, again, my colleague Jeanette is on here, Jeanette Lawrence, and I've spoken to her about this a lot. You know, the genetic counselors do provide counseling, and they're very knowledgeable about all of those issues. And certainly, you know, in general, it is felt to be, you know, studies have shown that really should not affect one's ability, you know, in terms of getting life insurance, et cetera. I mean, obviously, I understand the concern. And so I would certainly encourage that individual to discuss those concerns with a genetic counselor and potentially a social worker. But in general, it is felt not to be something that is of significant concern. So I would still encourage those who are viewing this and thinking about, should I have the genetic testing? Again, knowledge is power. So I'm definitely in favor of pursuing the testing.
Yeah, I do want to add that, you know, if you look at my situation where my mom was diagnosed at 41 and passed away at 47, when I went for life insurance, and that was actually before I thought about testing, that they already had that family history of mine. So that already put me into another category anyway. So since that was the case, I rather than have just undergone the testing. But I also want to say, just on insurance, it's a funny thing because I had a woman who called me. She was diagnosed with stage 2 breast cancer, and the recommendation was that she undergo an MRI. You know, Dr. Commander, you have referred to this. And so the insurance company said, no, we will only approve a claim for an MRI for a woman who is at high risk of getting breast cancer. So she calls me and she says, am I on candid camera? Is there actually a higher risk of getting breast cancer than actually having breast cancer? So sometimes these insurance companies, you know, are maybe not as careful, giving them the benefit of the doubt, or, you know, that sometimes it's not somebody who's medical who's making those decisions. So definitely follow up, appeal those decisions. And I find that a lot of the doctors that we work with, their office staff is great about helping out in those kind of instances.
Mm-hmm. Great, thank you. One more question that I wanted to pose on behalf of someone who says, about 10 years ago, I was able to get Tay-Sachs genetics testing for free through an organization affiliated with Tufts. Does Charlotte or any other organization offer free genetic testing for BRCA? And I want to just mention JScreen. I know you did as well, Dr. Commander. JScreen does offer some panels of screening. Why don't you share a little bit more, Dr. Commander, about the testing that they do, and then we can also share with you a coupon code, which is good still for a few more days, the end of this month. So over to you, Dr. Commander.
Right. So JScreen is one of the companies I think I listed on my slide, which does provide medical grade testing. So that is certainly an option. And I don't know how good your discount code is, but it's certainly something to consider. And again, but often insurance should cover this testing. And, you know, I hope it covers it, obviously, for all Ashkenazi Jewish individuals who might not quite be there yet, but I do think it's really important. And the genetic testing has gotten such, you know, it's much less expensive than it used to be. So that's actually, you know, a good thing that we've seen over the past few years in terms of these developments. I don't know if Shara, if you wanted to comment further on that.
No, that's a good
So
answer.
the coupon code is BCAM, Breast Cancer Awareness Month, BCAM, and the number 18.
I
so
love that.
Through the month of October, they're offering their screening for $18, I believe. So that's a significant discount.
That's amazing.
Before we end our Knowledge is Power program this evening, I do have some thank yous that I'd like to share and also some important programmatic information. So I'd like to thank Vassar Center for BRCA, which is a sponsor of Sharsheret Genetics program, and to the sponsors of this year's Sharsheret Summer, Eisai, GSK, Seagen, Daiichi Sankyo, Merck, Pfizer, Exact Sciences, and Lilly Oncology. Thank you to the JCC of Greater Boston. As I said, we look forward to collaborating with you as part of our new partnership. Thank you so much to tonight's expert presenters, Dr. Amy Commander and Sharad Dubitsky. Your guidance and your insights have really been invaluable. And thank you to Rob and to Irene for sharing very personal stories with people who are represented by little squares on your screen. You make it possible for others to gain strength from you when you talk publicly about your experiences, and you raise awareness in very meaningful ways, and that saves lives. Those of you who knew Lauren and who were part of 1 in 40's work will be especially interested to know that we have established a page on our website where Lauren's story can be found and where donations can be made in her memory to continue her work. You can take a picture of the QR code that's on the screen and it will take you there so you can view that. Next slide, please. This screen also has a QR code, and if you scan this one, it will take you to our Summit website, specifically to a digital information packet of life-saving information. We urge you to download it and to review it and to share it. You can find a wealth of information on the Summit site, including information about more local and virtual programs. And now on the screen, you'll see information about 3 upcoming programs I want to highlight. Next week on November 1st, we'll present a webinar entitled Navigating Insurance, appropriate given one of our recent questions, a conversation about coverage with Erin Bradshaw of the Patient Advocate Foundation. On November 9th, we offer a webinar for caregivers entitled When Cancer Becomes the Third Wheel, Maintaining Your Relationship During Difficult Times. And of special interest, on November 15th, as part of Movember, Sharsheret will be presenting our annual Men's Health webinar focused on hereditary cancer and what it means for you and your family. Finally, I want to remind everybody that Sharsheret social workers and our genetic counselor are available to help you or your loved ones, to answer questions, to connect you to resources, and to provide support. You can reach our team through the contact information that's on the screen in front of you now. All of Sharsheret's services are confidential. All of Sharsheret's services are customized, and everything that we do is completely free. Have a wonderful evening. We hope to see you at future in-person Boston-based programs and on our national webinars. Good night.